All right, so أعوذ بالله السميع العليم من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وصحبه أجمعين ثم أما بعد. My dear respected brothers and sisters, community members, everyone who is watching us live at this moment, Assalamu alaikum wa rahmatullahi wa barakatuh, and peace be with you all. We welcome you at this live session, but we would like to apologize for the delay. We had a technical problem, but alhamdulillah we have brothers working on it, and I hope now that everyone can hear us. And jazakumullah khair for those who texted me telling me that we can watch, we can see, but we cannot hear the voice. So now, alhamdulillah, I think it is fixed. Without any further ado, the topic tonight is very important. We are going to talk about mental health and self-care during the COVID-19. We talked about the situation from a faith perspective, spiritual perspective. We talked about it from a medical perspective. And tonight we are going to talk about it from a mental perspective. It's very important for all of us to take care of ourselves during this time. And all of us, we are affected by what's going on. And for this topic, we have invited a very active member of our community. We are very proud to have Sister Ala with us. And Sister Ala is a licensed clinical social worker who practices therapy part-time in the Muslim community. She received her master's in social work from San Diego State University and is currently employed in the Escondido School District. So honestly, Sister Ala is the person I turn to every time I have a case of counseling and therapy and anything that is in that nature. So, Assalamu alaikum, Sister Ala, we welcome you.
Wa alaikum assalam wa rahmatullah. Jazakallah khair for having me on tonight.
Allah yabarak feek, Allah yabarak feek. Sister Ala, what can you teach us tonight about the mental health perspective and self-care going through this crisis?
Yes, so thank you again for having me on. Very important topic in our community, and the world at large is suffering from not only the physical implications of this virus, but there's a lot of mental health implications as well. And so we know that this is a time of uncertainty, a time where we don't feel a lot of control in our lives. And of course, all of that can add to the stress and the panic and the anxiety that can be slowly building up during this time. So I just want to start by saying that, alhamdulillah, as Muslims, we know that our will and our entire lives are submitted to Allah subhanahu wa ta'ala. And we know that when we put our faith in that idea, in that concept that Allah has control over our lives, and we submit our will to Him, that inshallah, that lessens the stress on us, and we know that Allah is in command and He'll take care of it, and inshallah there is hope at the end. But that's also not to say that we need to, all the feelings of worry and fear and anxiety that we're having, we do have to acknowledge that. That's the first step in start sort of understanding where we are in this perspective, is that it's okay to have feelings of worry. It's okay to be afraid. It's okay to not know what's going to happen. And if we have children or young people in our households, then that's probably even more important at this time. We need to help them understand that this is a time of uncertainty, and that inshallah it's only a temporary thing, but that things will get better soon. So like I said before, knowing that this is a temporary affliction, and that with patient perseverance, things will look up when Allah wills it. And so I want to talk about this thing called patient perseverance. We all know what patience means, right? It's just to go through something and understanding that there's a hardship. But when we go through perseverance or patient perseverance, to me that means that we have patience with hope, and we know that we won't give up no matter what. And so as Muslims, I'm reminded of the hadith of the Prophet Muhammad ﷺ, where he says the state of a believer is, when things happen to the believer that's good, I'm going to paraphrase here, that he is always in thankfulness to Allah, and even in times of hardship or trouble, he also sees the good in that and is thankful to Allah subhanahu wa ta'ala. So that's a consolation for me. We know that we have patient perseverance, and inshallah we'll get through this together with the will of Allah subhanahu wa ta'ala. Another thing that happens for adults especially is that there's so much uncertainty right now. What's happening in the world is unprecedented. We haven't closed schools for reasons like this. Businesses are closed except for essential businesses. A lot of people are concerned about their livelihood, about their children's schooling. So there's so much uncertainty. And though we can't control what's happening right now, we can take control of how we are responding to what's happening. And our reactions and our behaviors kind of help us bring in our locus of control. Of course we're all afraid, and of course we're all worried. What's going to happen? Am I going to get this? Is my family going to be okay? I'm worried about my elderly parents. I'm worried about my children. But having that anxiety and panic kind of consume us isn't going to help us get the control that we seek. So we need to remember that our reliance is on Allah subhanahu wa ta'ala, and we submit our will to Him, and that helps calm the heart, inshallah. So I wanted to cover some points. I don't know, Sheikh Taha, do you want to just ask questions, or should I just go through it?
No, go ahead, please.
Before I go on further, I just wanted to say something about, that the feelings that we have are real, and we need to understand that it's okay to ask for help. So I did want to put out a phone number for the San Diego Access and Crisis Line, and this is a 24-hour phone line that serves the people of San Diego. It receives thousands of calls a month related to crisis intervention, community resources, mental health referrals, all types of abuse services. It's confidential and it's free of charge, and the line is immediately answered 7 days a week, 24 hours a day, by master's level and licensed clinicians. So I want to put that number out there. I wish there was a way we could type it or put it on the screen. But the phone number for the San Diego Access and Crisis Line is 888-724-7240. I'll repeat it, 888-724-7240. And again, this is a crisis line. You can reach out if you are having difficulty, if you need someone to talk to, need some resources. This is an excellent place to start.
Sister Ala,
yes.
Yeah, if you don't mind, just to remind you at the end, inshallah, we will put all these information on our website.
Jazakallah khair. Yes. Perfect. Another resource, again, if you haven't heard of it, is the 211 San Diego. And this is also online, and you can just dial 211 as well. So it's 211sandiego.org, I believe. I'll double check on that. And then, or just from any phone, it's 211. And again, it's a linkage to resources, mental health, any types of resources that you would need. So I'm going to just go through some points here, is that, we don't want this to consume us. We don't want this to overwhelm us and then live in a state of panic for Allah knows how long. We don't know how long this is going to last. We don't know how long our state of isolation and social distancing is going to last. But if we continue to think about that and we continue to worry, then we're definitely going down a slippery slope of unhealthy mental health or unhealthy habits. And so there are a lot of things that we can do to help ourselves and to help our families kind of retain that locus of control and, just try to survive. Because, whether we like it or not, we are kind of in survival mode. Nothing is normal. School's out, work's out, we're at home for most of the day. And we worry about, this illness. And so it's kind of like our brain is going in this survival mode. So we have to give ourselves credit. Like, we can't expect to go about our normal lives when we have this big worry about us. So it's okay, just take it slow, don't put too much pressure on yourselves. Don't put too much pressure on your children. We just have to understand that this is a temporary kind of survival state that we're in, and that's okay. So let's start there, inshallah. But here are some things that we can do, and I'm trying to practice this as best I can. I'm not going to lie, this is scary to me as well, and it's worrisome for my family. My mother, and I worry about her health. She's older. But I try to do things that I can try to take care of myself and take care of my family in the best way that I can. And inshallah, these will be beneficial to your families as well. So, be kind to yourself. Again, I'm going to say that again, because there's a saying in mental health, and a lot of people say it, is that you can't pour from an empty cup. And just think about what that means. When we are exhausted and we're giving so much of ourselves, or we're trying to put out the fires around us, we have to remember that we have to take care of ourselves as well, because, we're going to get burned out. And if we get burned out, then we can't take care of our children, we can't take care of our parents, we can't take care of our homes. So we really have to make sure that we are kind to ourselves. We can take advantage of the free time that we have. If we are not at work right now, or if you have children at school but that are not at school right now, there's so much that you can do in terms of your ibadah. I mean, this is a perfect time to develop that ibadah, to improve the khushu' in your salah, to read and contemplate the ayahs of the Quran further. Read the stories of the prophets, alayhim salam, and the seerah, to appreciate the hardships that the prophets went through, and the sahaba, and Prophet Muhammad sallallahu alaihi wasallam. There's so much in their lives that we can learn. They endured so much hardship, and they endured so much in their lives. And, did we understand, I guess the underlying theme, correct me if I'm wrong, Sheikh, is that, those hardships make us stronger and better believers. Exactly. Inshallah, that's the hope. And also when we practice thankfulness and optimism, like I said before, the true believer finds good in all of his affairs, or her affairs. We make dua, and we ask Allah to give us the best of the situation, and we ask Allah to protect our families. And so again, that dua and that relationship with Allah subhanahu wa ta'ala, this is a perfect time to increase and improve upon that, because we need to put our faith and our hope in Him. One thing that, as a mental health professional, I recommend to people who are going through some anxiety or depression is to start a gratitude journal. This is something that helps us kind of think about the good in our lives right now, especially when we don't have that control, or especially when we are consumed by sadness and anxiety, is to start a gratitude journal. It can be anything. It doesn't have to be a fancy journal. It's just somewhere that you can jot down on a regular basis. 3 things that you're so grateful for that day. It could be things that are so simple, like the beautiful sunrise in the morning, or, having that perfect cup of coffee in the morning. I know I'm grateful for that sometimes, alhamdulillah. Anything so simple, or like a compliment that you received, or the fact that you were able to get out of bed that morning, or fold the laundry, or, call a friend and ask how they're doing. Those things we need to appreciate, even though they might be small, but those things help us appreciate our lives and appreciate the good things that happen to us. So if that's something that you might consider, definitely start a gratitude journal. Make sure that you do it daily or almost every day. And just think about all the good things that are happening in your life right now, and that helps, inshallah. Another thing is that, like I said, it kind of ties into the gratitude, is that we give compliments to others, and we thank people for their service and what they do to us, as well as, give compliments to yourself. It's okay to appreciate yourself, and appreciate what you're doing for your family. Other things, these are, some things that were recommended in some of the mental health circles that I'm part of. Stay healthy. This is a time where a lot of people resort to unhealthy habits because of the panic and the fear. But the best things you can do to yourself to take care of yourself, part of that self-care, is to drink a lot of water, eat well, eat healthy, try to move and be active. I know that we're stuck in our houses, but there's so much that we can do. I know for my son, he can't go to martial arts classes anymore, but the awesome coaches are streaming, their trainings, and we watch them on YouTube, and then we do that together. And so that's so helpful. Even for children, they pick up on our anxieties, and they pick up on our worry, and sometimes, you can see that sensitivity in them now more often. So I'll get to that point later, but it's also a helpful way to kind of de-stress yourself so that your families can also feel that less of a stress. It's important to also stay flexible. Like I said, things are fluid now and the news is different every day. We don't know what's going to be different tomorrow. So just learn to make your mind flexible. Learn to be okay with things changing and not knowing what tomorrow holds. And so I think that's a big part of having that Iman and that faith, is that, we put all of that in the will of Allah, in the hands of Allah subhanahu wa ta'ala, and He'll take care of it. So it's okay to be flexible. Just, the more we try to have that control, the more we try to have that, I need to know what's happening, and I need to know how many people are getting this, and I need to know what to do and where to go and buy all these things that I need to buy. The more we try to control those things and we can't, the more that can cause a lot of the anxiety and the fear and the panic in us. And so we need to reduce that, inshallah. Like I said, learning to be flexible and accepting things for what they are right now, that helps us just to be more adjusted. Another thing that is recommended in our mental health circles is to stay clean, keep your spaces clean, and keep your spaces organized. Because of course we know that, when things are messy or when things aren't organized and clean, it can have a negative effect on our psyche. And so we need to make that effort. It's just, do something small at home to organize something, or to keep your living room clean or your bedroom clean. It's okay. Just anything small that helps you do something positive for yourself. Social media, because when we are consumed by all that news, that negativity, the scary stuff, that has a really bad effect on our mental health. We can't expect to watch all these horrible broadcasts from Italy or China or, even now it's happening in New York City, and expect us to be okay. So we really need to make sure that we limit our social media time, limit our time on the news, because that's just going to have such a big impact on our mental health. Your brain gets tired by just watching all this news, and you get overwhelmed, and we don't want that. We don't want that at all. So I'm going to talk about now, if we have young children at home, the importance of routines and schedules. So when our kids were at school, they had a pretty set routine. You wake up in the morning, you get ready for school, you take them to school, you come back, homework time, all that stuff. But things are changing now. And like I said before, nothing is normal, but it's still a really good idea to implement some sort of routine at home, because we want to make sure that the kids feel a sense of normalcy. So like I said, routine and structure is super important for children, especially for families with children with special needs. Those routines are key. It helps them kind of just, be at peace a little bit better. So develop a schedule together. If that's something that you can do with your children, if your children are old enough, you can sit down with them and get a piece of construction paper and write down routines or things that you can do to kind of help you Monday through Friday. Is there going to be learning time? Is there going to be cleaning time? Is there going to be Islamic, khatira time, or, study, or Quran or Sira stories or anything like that? So you put that in the schedule and you try to follow the schedule as to the best of your ability, just so that it helps maintain that sense of normalcy that is so important for not only children but adults as well. Like I mentioned before, children do pick up on our emotions. Sometimes we are so worried and we watch the news, and we sometimes watch things that we shouldn't be watching in front of children, and that can be very detrimental to them. But if you feel like your children are anxious or worried or hypersensitive a little, then, just sit down with them and ask them questions about what they're feeling, what they're thinking, what's going on in their minds. And that's helpful to them because, you want to make sure that you listen and validate their concerns. If this is a scary time for adults, then this is probably doubly scary for children, because you know, maybe they don't know what all is going on, or they have so many questions that they're afraid to ask their parents. And so we just have to give them that time and opportunity. You know, what are you thinking about? What do you know? Tell me what your thoughts are. Just have that two-way conversation with them that helps them feel heard. And that's important for children as well as adults. Also, we want to talk about just, you know, it's okay to be distracted. Like I said before, we don't want to be overly consumed by all the news. It's okay to do something good for yourself, you know, reading a book, playing a board game, painting, art, things like that. That's okay to do because, you know, it helps with confidence, it helps with your self-esteem, it helps to distract you from all the negative news around there. I'm not saying that the news is not important. I mean, it's good to know, but we don't want to completely consume us. You know, do things with your family, take a walk outside if you can, and if it's safe enough that you can do social distancing, which, by the way, please, I'm asking you to do. This is one of the best ways that we can avoid this. Just please stay at home when you can, only go out for essentials, or when you can make sure you can do effective social distancing. If you have a backyard or a patio, go out there, get some fresh air. You know, contemplate the creation in Allah's nature. You know, it's such a beautiful way of ibadah, just looking at nature and appreciating the creation. Practice mindfulness. So mindfulness in Islam, I mean, we pray and we have khushu' in our ibadah and we read Quran, but also mindfulness is just kind of turning the world off and looking inward and being one with yourself. Notice your breath, notice your heartbeat, notice how your mind and body are connected. You know, because when we have that, like those feelings of like, I'm listening to my heartbeat or I hear my breath and you have to do the deep breathing, that helps kind of calm the body and calm the mind. And so that's definitely something I recommend too. And one of the last things maybe I want to say before the questions is find some ways to be of service to others. I want to just commend, mashallah, our Islamic Center for doing a great job with reaching out to the elderly in our community and having the young people help with that. I think that's so wonderful, mashallah, that you guys are doing a service. And not only are you doing a service to those elderly people that need it, but I feel like in return you're getting a service, not only an ajr from Allah subhanahu wa ta'ala, but also like a feeling of accomplishment or you're doing something good for yourselves. And of course that helps you in your mental health. Volunteerism in mental health, they recommend if someone is depressed or anxious to volunteer, find a way to help others, because that in return will help yourself.
Great, mashallah, mashallah, Sister Ala. Are you done or? Go ahead.
Pretty much.
Yes.
But if there are any questions, I'll be happy to answer them.
Not necessarily questions, but
Excuse me.
it's amazing to see the connection between the mind, the spirit, and the body. Mm-hmm. And subhanallah, the concept of tarbiyah that we have within our faith. Tarbiyah means to nurture our mind, to nurture our spirit, and to nurture our body. And it's very important to make that balance and to help connecting our minds and spirits and bodies and take care of them all together at the same time.
Yes.
This is something very, very important to understand, right?
Yes, absolutely. I mean, it's all connected. You know, when we have our iman, it makes us better people. It makes us healthier people, not only in physical health, but in mental health as well. Mm-hmm. So Allah subhanahu wa ta'ala put that inside of us that, you know, we need to take care of all of our aspects or every part of our aspect or our body. So subhanAllah, it is all connected. Mm-hmm. And the one thing that I do want to mention, and this is why I started with the crisis line, is that in this time of uncertainty, we see a lot of stress in the family system. And sometimes, I was just listening to another webcast the other day, is that we often see in times of trauma and uncertainty an increase in family violence and abuse and domestic violence. And that's often because of that increased stress and worry and panic in the home. And so that can all kind of make us hypersensitive to the anger that we're feeling or the worry. And so we see that happening. And so if this is something that you feel that might be happening in your home, the first step is to have that awareness. The first step is to understand and acknowledge that, you know, this is something that you might be struggling with, and to reach out to get help. So, you know, I just want to normalize that part, that we're all kind of in survival mode, we're all in stress mode, but that there's so many good resources out there to help. And another thing is, you know, just because we talk about social isolation, that doesn't mean that we are also talking about emotional isolation. So social isolation means that we're distancing ourselves and keeping 6 feet apart, but we still need to be connected. Allah subhanahu wa ta'ala created humans as social creatures, and so we need that social support, and we need those people to help us feel good about ourselves. And it's okay to ask for help. Like I said, it's okay to reach out and talk to loved ones that maybe you can't see face to face, to call a friend and just to validate each other's feelings. Reach out to family members that maybe you can't see now because of the isolation, but definitely understand that we do need one another as social creatures to feel that love and support, and to increase our iman, inshallah.
Yes, Sister Ala, we just had received a question from a member of the community asking if you can do some sessions like this with the youth.
I would love to, inshallah.
I'm sure you are going to say yes, of course.
I can't say no.
So yeah, we can do this. We can talk about it. Our youth, just to let our community members know, our youth are doing their own virtual program. Actually, they started yesterday with our youth director, Brother Asim, and some of the youth leaders. But they are not doing it this way. They are doing it through Zoom. So it's kind of like a closed circle. So we're going to have you, inshallah, Sister Ala, to do a session for our youth through Zoom, inshallah, okay?
Inshallah. Inshallah.
Yes. And we started having some questions coming here. Another question saying, how can we train ourselves to live in the present and not worry about the future or what the future holds?
That's an excellent question. Jazakallah khair to whoever asked it, because that's absolutely where that panic and anxiety comes. So I've heard Sheikh Abdul Jalil mention this before, and it's one of the tenets of psychology, is that when depression happens, when we think about the past and lament the past and our choices in the past or the events of the past. And anxiety comes from our over worry or over stress of what will happen in the future. So we do have to definitely live in the present. And there's so much that we can do to try to improve our living in the moment. And some of the ways we can do that is just to understand that, you know, we are human, and we have faith in Allah subhanahu wa ta'ala to take control over all situations and do things that make us feel in control in the moment. So anything like I mentioned before, staying healthy or staying flexible, focusing on the things that you enjoy, focusing on the things that help you feel good about yourself or your family, you know, distracting yourself, reading, you know, praying more, extra dua, extra things that will just help you feel good about yourself and focus on what you can do today. That gratitude journal, or understanding that, you know, this is what I'm capable of doing. Alhamdulillah, this isn't within my capabilities, and I'm not responsible for what's going to happen tomorrow or the other people that are in control of the hospitals or the clinics. Or, you know, there's a thing in child psychology as well, where we teach children that locus of control. Things that you can control are categorized over here, and things that you can't control are categorized over here. And so when we think about the things you can control, your reactions, your behavior, your good deeds, and you focus on those, you have to understand, and slowly, inshallah, but surely, that the things that you can't control, other people's actions, other people's behavior, other people's reactions to things, you kind of have to let that go, because there's no point in worrying or overthinking about what those other people are doing. So just focusing on the things that you can control, focusing on the things that you can do to make you and your family feel better. Inshallah, that'll help you stay focused on what you need to do to.
Jazakallah khair, Sister Ala. And for Brother Mukarram, Jazakallah khair, we got your comment and your compliment. May Allah bless you, and please make dua for us. There is another question. A young sister in the community is asking, could you ask Sister Ala what about the age group that is in college right now and how they go about their mental health, yet still trying to balance their school since now all the colleges are online?
That's an excellent question. Jazakallah khair for asking that, sister. I remember when I was in my master's program, I'm not going to date myself, a long time ago, we had fires in San Diego, and they had to shut down our school. I think it was 2 weeks. So there was a lot of time of uncertainty. Of course, the students were happy that they didn't have to do exams or go to classes. But of course, it's we wanted to make sure that we were also doing something good for ourselves. So I would say take advantage of the time that you have now, not going to classes, or I know that you're doing online studying, but you really do need to focus on what you can do to make yourself feel better. So as a college student, mashallah, you're one step closer to the real world. Think about ways that you can be of service to others. What can you do from the comfort of your home right now in isolation to stay connected with the world around you? Is there something that you're really good at, or something that you know so much about your area of study that you can share with the world, that you can share with younger siblings, or that you can share with your community? If you're studying a certain aspect, like if it is mental health, then share some of those pointers with your family or with your community. If you're studying something else, or if you're really into computers, what can you do to help your community with what you're good at or what you're studying? So just know that, Allah subhanahu wa ta'ala gave us all different capabilities and skill sets. And in this time of trial, you can ask yourself, how can I offer my services to my community, not only to help them, but to help myself through it too.
Great. Jazakallah khair, Sister Ala. I have something that, an idea that I would like to add here. Even though you said that we should take a break a little bit from social media and the news, but I found it very important for families and individuals to share ideas through social media. For example, something that they have experienced at home, an art project, for example, like in the last few days, my daughters, they painted, each one of them painted something. And then actually we have an exhibit at home that I posted on social media. And I've seen a lot of people liking that and commenting on that and all that stuff. So I really would like to see my community members, if they have anything doing at home that is working good, just to share it. The other day, one of the mothers in our community, posting a daily plan for her kids, doing different things throughout the day, something that a lot of people can learn from and duplicate. Why not?
Yes, absolutely. And I think it's good to share the positive. When I said limiting the social media, it's just to limit all that negative news and the negative things that we see that might affect us in a bad way. But if we do share the positive, which I love, and mashallah, your daughter's artwork is amazing, we want to make sure that we can stay connected. And social media is an excellent way of staying connected with our community, with our family members, with people abroad. And that helps us hone in that sense of community and that sense of just humanity. And that's what we need right now. So yes, thank you. Good point.
Great. So we don't have any question at this moment. So Sister Ala, Sister Ala, we would like to announce to our community members a service that we would like to provide, we would like to offer to them. mental health support program. And you were so gracious to accept when I asked you to do this for our community. So would you please talk a little bit about it?
Yes. So Alhamdulillah, I'm in a position now where I have some time that I can reach out to my community and offer the support. I want to say that if anybody in the community needs help, has questions, needs some support with mental health or linkages to services or resources, I am willing to give some of my time during the week, Mondays, Wednesdays, and Fridays, for 1 hour in the evening. I haven't really thought of if it's like 1 hour just for one individual or one family, or maybe we can just break it apart. But if you would like to reach out to me, you can either reach out to the masjid, the ICSD office, or I can provide you with my email address right now, and you can reach out directly to me. And inshallah, I'd love to offer the support, because like Sheikh Taha mentioned earlier, you know, the mental health component of all of this is very important, and you know, we need to support each other through this. Yeah. So I'll just put out my email address. It's asnamantherapy@gmail.com. I'll spell it for you. AS, N as in Nancy, AA, M as in Mary, AN, therapy@gmail.com. And inshallah, we can put that up on the website if that's okay with you, Sheikh Taha.
We will share this information with our community members on our website and also our WhatsApp group.
Okay.
So the last question, we just received another question. Please, tips to control. Hold on. Please, tips to control anxiety due to COVID-19.
Good question. So anxiety over this. First step is, like I said before, we can't control who's going to get this and who doesn't. We don't know how severe this is, what it's going to look like tomorrow, what it's going to look like next week or in 2 weeks or a month. So the first step we can do is just say, I don't know what this is going to look like. I don't know how this is going to affect my family, but I'm going to learn to be okay with the unknown. So just kind of help you understand that it's okay to not be okay, first of all, and it's okay not to know how this is going to affect us. That's the first step. Submit your will to Allah subhanahu wa ta'ala and say, if this is in Allah's hands, no matter what happens, this is His hikmah and this is my nasib. So we can't panic and anxiety about something that we know that Allah has already preordained for us. This is the one step, that maybe the first thing we can do. The next thing that we can do for the anxiety is talk to someone. If it helps to talk to a family member, if it helps to talk to a friend, if it helps to reach out to any mental health person that you know within the Muslim community or outside of them, that's okay. The third thing is to learn to control the things that you can control, or do the things that you can control. What are the things that will make you feel better? What are the things that you can do within your life to center that locus of control again? What can you do in your life to maintain that sense of control? Think of the things that will make you feel better. Think of the things that will help you stay in control. So just reliance on Allah subhanahu wa ta'ala, reaching out for support, and focusing on the things that you can control in your life. Those are maybe the first few things. And inshallah, maybe in upcoming conversations, we can talk more about that.
Jazakallah khair. Jazakallah khair. Brother Mukarram, Jazakallah khair. Inshallah, I will submit your request to our youth director. Inshallah. And another question, it says for Imam, I see many dua online for COVID-19. Is this real or bid'ah? Okay, I don't understand dua for COVID-19. I mean, making dua, asking Allah subhanahu wa ta'ala to protect us, to strengthen us, to keep us safe and healthy. Of course, this is sunnah to make this dua, if not wajib at this time. If dua for COVID-19, we are not supposed to praise a sickness or any harmful things. we're supposed to ask Allah subhanahu wa ta'ala to take away from us these harmful things. If you mean online dua, of course, I mean, online dua is like using any means of communication or technology. Making dua online or through a website, through social media, through a phone, any means of communication, then that's fine. We are supposed to use all these options we have nowadays in order to promote the dua and ibadah and righteousness and piety, and so there is nothing wrong to make dua. I have seen some shuyukh, some scholars, even some brothers and sisters online just posting some dua. That's fine. You can listen to the dua, memorize that dua, or just say Ameen. Listen and say Ameen after that dua, inshallah. So there is nothing wrong with that, bi'idhnillah. So at this moment, we come to an end to this session. Again, Sister Ala, Jazakallah khair, may Allah reward you. May Allah bless you and bless your family. May Allah keep your mom healthy all the time. Abdullah, mashallah, your husband, your child, your in-laws, everyone. May Allah bless all of them and all of our brothers and sisters in the community. Keep us safe all the time. Brothers and sisters, we will share with you all the information that Sister Ala wanted to leave for you, so you can reach out to her seeking mental health support during the times that she has mentioned. And thank you so much for offering your time at this very critical situation. Brothers and sisters, we will continue our online teachings and sessions for the next few nights, inshallah, every night at 7:30 p.m. Next time with Imam Abdul Jalil, inshallah. And I will see you, inshallah, on Thursday with more experts from the community, more guest speakers from the community, teaching us, educating us, and helping us to understand what we are going through at this time, at this moment. Keep making dua, stay at home, comply with the order of our governor, our county, our city. May Allah subhanahu wa ta'ala keep us safe, all of us, our loved ones. May Allah subhanahu wa ta'ala ease the situation on the people of the whole world, especially those places that are hit the most. Jazakumullahu khair, barakallahu feekum, hafizakumullah, wassalamu alaikum wa rahmatullahi wa barakatuh.